Hello, guys. My name is Kevin. Um, I'm new to this, so um, I'm here to help people that's got mental health problems. Um, you know, I'm not a therapist. I'm not a psychologist. I don't do. Um, I'm not a licensed prescriber, so I can't do that. All I can do is introduce you to the 10 personality disorders and some other mental health disorders, but I'm not going to do it all in one day. I can't. It's just, it would be way too much. I would be sitting here all day and then half the night, um, trying to cover all of it. So, the first thing I want to introduce to you is, well, first things first, I did a lot of research and I watched a lot of Dr. Todd Grande's videos and stuff, and I put two and two together. And as a husband that's married to someone that's got borderline personality disorder, which is a cluster B in the personality disorders, this is why, and also I have a cluster A personality disorder, which is avoidant personality disorder. I won't shy away from that. So I'm doing it to help people like us and with avoidant personality disorder and other personality disorders. I also it's not as hard for me to do videos, upload them on YouTube as it is going out in person. Believe me. Going out in person is tough. It's really, really tough. Especially in the immediate family. Now, when it comes to immediate family, I am very shy. And you would think that that it wouldn't be that way. But that's the way it is with avoidant personality disorder in some people, or at least in my case it is. So, we're not going to start with that personality disorder today, and we're not going to start with borderline personality disorder today. We are going to name the 10 personality disorders as they go. We're going to start with cluster A. This is paranoid personality disorder. That's the one we're going to do today. The other ones are schizoid personality disorder and schizotypal personality disorder. Okay, that covers cluster A. Now, cluster B is the most severe type. These are the ones that really, really, really can get ugly. Antisocial personality disorder. That's a really bad one. Narcissistic personality disorder can be pretty bad. Borderline personality disorder can be pretty bad. Histrionic personality disorder, it can be pretty bad too. It's not as well known as the other three, but it's there. So just want to cover that. It's there. So cluster C is where I fall into, is where my personality disorder falls in. Avoidant personality disorder. Also in that cluster of personality disorders is dependent personality disorder. Also, the last one in that cluster of personality disorder is obsessive compulsive personality disorder. Okay? So that covers the 10 personality disorders. There are some other disorders, bipolar, schizophrenia, and stuff like that there. But the one thing that we're going to talk about today is we're going to start with the cluster A personality disorder, and we're going to do one personality disorder per day. So, this personality disorder goes as paranoid personality disorder. And this is what we're going to start off with today. Um, okay, now here are the symptoms of paranoid personality disorder. And I'm going to read them some offline, and I'm going to add to it, because I don't want to be got for copyright. I'm doing a lot of research on this, so I'm learning. I'm still learning a lot. Like I said, don't look at me as a therapist or anybody that you can come and talk to. You can you can talk to me on YouTube and stuff, and I respond. But I'm not a therapist, so I highly advise if you think you've got one of these personality disorders to seek counseling. If you think that you've got one or feel that you are in need to talk to a counselor and stuff, you need to do that. Also, I want to talk about something else, and some mental health professionals will agree with me on this, some will disagree with me on this. Sleep disorders often accompany things such as depression, severe depression, bipolar, type 1 and 2, depression. Bipolar is a type of depression more than a disorder, in my belief. So, but I'm not a therapist, so. All right, so here's the symptoms that we're going to start off with today of paranoid personality disorder, which is a cluster A personality disorder. People with paranoid personality disorders are always on guard. They're always on guard, no doubt. And believing that others constantly trying to demean them or harm them or threaten them. Okay? These generally unfounded beliefs. They're generally unfounded beliefs. So, as well as their habits of blame and distrust. Okay? So, interfere with their ability to form close relationships, people with this disorder. Now, not all, this is where I disagree with the website at. Some people with paranoid personality disorder, they can hold relationships, and some of them can form close relationships, and, some of them can't. So there's where I differ at with this. It also says, doubt the commitment, loyalty, or trustworthiness of others, believing others are using them or deceiving them. This can be true to an extent. But we're going to read all of this, and then I'm going to give you what I think of paranoid personality disorder. It says they are reluctant to confide in others or reveal personal information due to fear that information will be used against them. Now, this is where sort of in a way, but not fully, avoidant personality disorder can come in. It can have a trait of it, like crossover. It says they are unforgiving and hold grudges. I tend to disagree. It just depends on the person. To some of them with paranoid personality disorder, yes, definitely. But I wouldn't say 100% would be unforgiving and holding grudges and stuff. Okay, and then it says are hypersensitive to taking criticism poorly. That could be a very well possibility. It's a very well possibility. And the same thing could be said about avoidant personality disorder too, because I don't like taking criticism. I don't. And that I I've been criticized. When I grew up, I was brought up in a situation like that. You know, all except for my grandma, she was great to me. My mom and my dad and stuff, it was criticizing, especially from my dad. But and this is can come from, you know, from childhood, a trait of it. And that's why this personality disorder can develop as part of what happened in your childhood, but not always. But the criticism in this disorder, as in a lot of disorders, is characterized as we take it not very good. Especially those with BPD, borderline personality disorder. Okay, but we're staying on topic here with paranoid personality disorder. Okay, it says read hidden meanings in the innocent remarks or casual looks of others. Yeah and no. I mean, I would tend to agree with that. Perceive attacks on their character that are not apparent to others. They generally react with anger and are quick to retaliate. Now, just because they may act with anger and stuff, it doesn't necessarily mean that they're going to retaliate. Like, retaliation is like, you do this, I'm going to do this. You do something this bad, I'm going to do something this bad. And, or if not worse, retaliation, in more times than not, it is worse than what happened. So, those thoughts can go in either personality disorder, in all 10 of them, really. And then it says, have recurrent suspicions without reason that their spouses or loved ones are being unfaithful. Yeah. Yes. This is the truth. Unfortunately, this could be, and the same could be said for some other personality disorders, but mainly paranoid personality disorder. And then it says, are generally cold and distant in their relationships with others and might become controlling and jealous. Now, with that right there, it's true, and then there's some overlap there with paranoid personality disorder and avoidant. Avoidant personality disorder means you become distant from others. And then in society today, people think, oh, this person's becoming distant from me or distant from the family and stuff. There must be something really, really wrong with this person. It turns out there could be, and it might just be avoidant personality disorder. Or it could be paranoid personality disorder. Paranoid personality disorder is seeing as to believe in things that are not true. It may actually be in classification as, like derealization, maybe. And then it says, cannot see their role in problems or conflicts and believe they are always right. Yes and no on that. But it's possible, surely, definitely. Um, but this is one of the traits when if you're going through this, you know you need to see a therapist because they can. This disorder is treatable, most definitely. Um, Having difficulty relaxing, same could be said for all disorders, really. Um, are hostile, stubborn, and argumentative. Yes. Um, but now, if we mention the word stubborn, then there's millions of people out here that's stubborn. So just because they're stubborn, does that mean that that they got paranoid personality disorder? No, it don't. Um, just because they have difficulty relaxing and stuff, that doesn't mean they got paranoid personality disorder. Um, I don't want to judge and say that it that you don't have it because some people that do have this disorder. Um, but if you have all of these symptoms, there's a good possibility that you do have it. No, but not all symptoms will be present at start or will be present at all the time. Then it says what causes paranoid personality disorder. The exact cause is unknown. That's true. Um, and it could be something as small as, well, at the time is big, but when you're grown up, you go back and look at it, it could be um, the living situations and the environment that you were around and stuff when you were growing up. Um, that's what can be same can be said about avoidant personality disorder too, because a lot of people that's got avoidant personality disorder, some of them were in some really really bad um, childhood, and it was bad enough that they don't feel safe, conversating or going out in the public and stuff, in fear of criticism. Same could be said for paranoid personality disorder, but um, the, the thing that I want to say is if you've got paranoid personality disorder, it's not the end of the world. There is treatment out there, and you have to seek it. And then it says, how is it diagnosed? If physical symptoms are present, the doctor will begin an evaluation by performing a complete medical and psychiatric history, and if indicated, a physical exam. Although there are no laboratory tests, no, there's not, to specify, diagnose, or of any personality disorder. There's no scan, no MRI, no CT scan that can diagnose a personality disorder. It has to be verbal, and it can't be diagnosed by your therapist on day one. If it is, you might or you might not have a good therapist. I prefer to be slowly weaned. Weaned. When I talk about weaned, I talk about weaned into, slowly getting to the root of the problem. And I had a pretty good doctor, and now my disorder has gotten me to where I've actually feared to go to doctors and feared to go to therapists and stuff, but I'm just now starting to go back. So the fearness waxes and wanes. For me, it gets really, really harsh at times. But there's no laboratory test, there's no CT scan, there's no MRI, no PET scan, no blood test, no nothing that can diagnose a mental health disorder. You just can't do it. If the doctor finds no physical reason for the symptoms, he or she might refer the person to see a psychiatrist or a psychologist. Healthcare professionals are specially trained to diagnose and treat mental illnesses. Not medical health care, mental health care professionals are the ones for that. Psychiatrists and psychologists usually are specifically designed to interview and do a full assessment, which takes dreaded 2 hours. I don't like that, I know. To evaluate a person for a personality disorder, but to me it takes longer. You need quite a few trips to get a definite diagnosis. I can't see a 2 hour thing just coming up out of the middle of nowhere and then they just saying, well, you just got this. No, I think you need, and I'm not trying to speak against psychiatry here by no means, but I think you need to go a couple of times before you can really get to the root cause of or the root problem of what's going on. People with paranoid personality disorder do not seek treatment on their own because they do not see themselves as having a problem. This is true and not true. This is true and not true. But it just depends on the person, really. When treatment is sought, psychotherapy, a form of counseling, is a treatment of choice for PPD. Treatment likely will focus on increasing general coping skills as well as on improving social interaction, communication, and self-esteem. So, that could be said for avoidant too. Because trust is an important factor of psychotherapy. Treatment is challenging since people with PPD have such distrust in others. They don't all have that much distrust. Some do. There's going to be some that this is right about, but not always. As a result, many people with paranoid personality disorder do not follow their treatment plan. And that could be true. And that's where that and avoidant personality disorder can overlap a little bit. But there's differentials too. So the differentials you can see. Medication generally is not a major focus on treatment for paranoid personality disorder. However, medications such as anti-anxiety, antidepressant, or antipsychological drugs might be prescribed if the person's symptoms are extreme, and they can be in paranoid personality disorder, but not always. Sometimes you really can get by with just therapy. Oftentimes you can't, and there's not really a scientific proven method that the medications work. Doctors really have to be careful when they're prescribing these medications, because some doctors tend to want to yank you off and then put you on another one and yank you off and put you on another one. That's when a problem, it can make the personality disorder worse and can cause other issues as far as health issues too. So you have to be careful as a doctor, that's for sure. Yeah, the antidepressants and anti-anxiety drugs and stuff could be prescribed if it's extreme, or if he or she also suffers from associated psychological problems such as anxiety or depression. Generally, depression is going to be there with paranoid personality disorder. Anxiety, yes, but I'm not fully believing in everything that it says, because it just doesn't seem, like that it could be all of these symptoms that it's saying, they're not going to present at one time. They're going to present, and you may not have every one of them. There's some symptoms you may never have. So, generally speaking, this personality disorder is, like I said, I'm not a therapist. I'm not a psychologist. I'm not a medicine doctor. I'm not even in the medical field, the mental health field. I am as far as a patient, but if I had to give you my opinion on the severity of paranoid personality disorder, it would be moderate. So that concludes this video about paranoid personality disorder. Once again, if you believe and if you believe you have disorder, it's highly important that you seek therapy and seek to talk to someone. Do not discourage you from doing that. So, hope this video helps. And this is the beginning of my channel, and there will be a lot more videos coming. And there'll be some videos, coming, that is part of mental health in society, like away from the diagnostic manual or DSM-5 that are going on in like real life, as far as things I see on the news and stuff, and some severe cases that I see in court. Like I said, I'm not a therapist. I can just give my opinion. There is this one case in South Carolina that I'm going to do, and I will give my opinion on that, but it won't be in this video. This one's about paranoid personality disorder, and like I said, if you think you have this disorder, I highly trust that you will go get treatment for it. And thank you for watching this video. If you've made it through to the 30-minute mark, thank you for watching this video, and I hope that I have made you feel better, and that's my intention, is to make people feel better, and also to help other people that's not part of the paranoid personality disorder or mental health personality disorders. Help them with people that's going through this. So the paranoid personality disorder as well as others. So thank you for watching, and I will be making more videos. Stay tuned. Don't forget to hit the like button and the subscribe button, and take care of yourself, and thank you for watching.